Welcome back to Cancer Buzz, the podcast of the Association of Community Cancer Centers. I'm your host, Summer Johnson. In this mini-episode, part 2 of our series on the role of advanced practitioners in equitable care delivery, we hear how APs can improve diversity in clinical trials by bringing their experiences to the trial design and accrual process. What you need to know is next. Oncology advanced practitioners can and want to play a greater role in clinical research. According to a recent study and a virtual summit hosted this spring by ACCC and Harborside, where advanced practitioners convened to define the role of oncology advanced practitioners in equitable cancer care. Today's guest says advanced practitioners have such a deep role in the day-to-day cancer care decisions, it makes sense to have them more involved in trial design, eligibility criteria, and ensuring that trials are diverse. Christa Braun-Inglis is a nurse practitioner and clinical researcher at the University of Hawaii Cancer Center in Honolulu.
The reason I feel that advanced practitioners should have more involvement in cancer research is that in present day, we do so much of the clinical care for oncology patients that I feel that we have great insight on multiple levels, not only to accrue patients to trials, but also to manage patients on clinical trials, and furthermore, to know if a trial is actually feasible within our practice site, and finally, to help with development of trials, because we know the clinical practice landscape so well.
How are oncology advanced practitioners particularly qualified to design quality improvements research related to things like adverse event prevention, mitigation, and management of those events?
We are routinely managing patients on cancer treatment. Every day, we're making decisions on whether or not it is safe to treat patients. We're managing their side effects. We're making recommendations on dose modifications. This is what we do. We're dealing with side effects of treatment. We know how to identify adverse events. We know how to manage adverse events. So in the realm of clinical research, it just makes a ton of sense for us to be managing patients on trial.
What do you think is not currently happening?
So what I think is not currently happening in the majority of clinical practices is I don't think we're being utilized to our full scope or our abilities within the realm of clinical research. But I think part of that has to do with advanced practitioners and their education about clinical research. I actually believe when we follow patients on protocols, it makes us better healthcare providers because we learn. I always learn from protocols that I have patients on. I learn how to manage patients even better by the protocol. However, I think that sometimes advanced practitioners are apprehensive to get involved with patients on trials because they think it's more work than it is in their everyday practice. And I don't think they're routinely integrated into the workflow in many practices to take care of patients on clinical trials.
Why do you think that advanced practitioners have a critical role to play in increasing diversity in cancer clinical trials?
When I think about diversity, it goes back to, again, we're just another provider. We do so much of the clinical care now. There's over 80% of oncology practices report that they actually employ advanced practitioners in their practice. And we know the patients. We're seeing them routinely. We see them more than the physician. So we build these relationships with these patients, and we can actually have better discussions with them about why we feel that it's, important for them to be involved in clinical research, why it's probably the best type of care for them to get. And when we talk to all of the patients, not just specific patients, and we build these relationships with them, it actually does increase equitable care, and it can increase diversity. I mean, I talk to my patients, I work with a lot of Pacific Islander patients, and I say, hey, we don't have a lot of Pacific Islander representation, in these trials. And then we base decisions on a non-diverse population, through clinical research. So I always talk to my patients about it's really important to have a voice, to be involved. And I think that being an advanced practitioner, we may have more opportunities than our physician counterparts to discuss this with our patients.
You can find more information on advanced practitioners and clinical research on the ACCC website. If you've been enjoying the Cancer Buzz audio podcast, check out the brand new Cancer Buzz TV channel. There you'll find even more in-depth conversations and topics on the latest trends in cancer care. Just search for Cancer Buzz TV on Apple Podcasts. Until then, for the Cancer Buzz team, this is Summer Johnson.
Cancer Buzz is a resource of the Association of Community Cancer Centers.